My name is Sabrina Strickland. I'm an orthopedic surgeon specializing in sports medicine. One of the most common injuries I see is ACL tears. And the typical ACL tear is a high school or college cutting athlete, a soccer player, a lacrosse player, a basketball player. There's a second group of ACL tears in the 35 to 55-year-old skier. And so how I approach an ACL injury really does depend on the goals of that patient. I think the most difficult question for myself and my patients is which graft to choose. And when I'm deciding between a quad or a hamstring or patellar tendon, first of all, I've pretty much stopped using patellar tendon. I think the morbidity, what you actually lose or what hurts after surgery, is far too high for a patellar tendon. I would say my quad's not that big. I would choose a hamstring. If you have a good sized quad and really strong quads, I think quad's a great answer. So it really, really depends on the patient. I talked to a patient yesterday about a hamstring, but she said she's had chronic hamstring issues after running a marathon. So clearly a hamstring's not a great option for her. We started doing bear, which is a technique to essentially save the ACL and use your own tissue to repair the ACL and augment it with a collagen graft. There have been also advances in other techniques that we can add to an ACL, such as the LET, and an LET stands for lateral extra-articular tenodesis. This surgery adds about 8 minutes to the surgery, but it's been shown to reduce re-injury rates by 50%. When I think about recent advances in ACL surgery, so we've been doing it, or I've been doing the actual surgery pretty much the same for the past 10 years, meaning all inside. So we have these amazing drills that curve, and so that allows us to be much less invasive as far as the surgery and put the tunnels more precisely where we want them to be. We also have a little drill for the tibia where it's a skinny pin, but the tip of the pin bends and allows us to drill backwards so we don't have to come all the way through the bone. It just makes it less invasive, and it allows us for certain types of grafts to take a shorter graft, which means less morbidity, or you lose less from taking that graft. Or for a hamstring, most often we just take one tendon. But I think this is all about talking to your surgeon, making sure your surgeon's comfortable with the graft that you want to choose and which surgery ultimately to undergo.